Hi guys, welcome. I'm Ruth Ochoa, and today we're going to go over one of my favorite stretches. It's a great way to open up the whole front of the body, great way to deal with low back pain, hip pain, pain in the thighs, knees, even shoulder pain. So many of us spend most of our day these days with our arms forward, right? We're typing, we're driving, we're texting. All of this, the body's forward, forward, forward. So that can often tend to create a lot of restriction in the front of the body, whether it's the pectoral area or in the abdomen. And what will happen, the tissue is so strong that it will eventually start to actually pull us forward. So we'll feel our head coming forward, shoulders, we'll feel that often as pressure in the low back. And until we resolve what is creating the discomfort, which is this restriction in the front of the body, you're never really going to feel like you can truly sit up straight. So give this one a try. It's a great way to really feel good today. Bring your latex ball with you if you have it, and your timer. You'll be at your bed today for this one. So go ahead and make sure you have a chair nearby if possible, and put it right next to the bed, a little bit at an angle like this. If you don't have a chair you can move, it's okay, don't worry about it. And then let's just safely climb onto our bed very carefully. And we'll be stretching the left hip first today. So you want to be positioned so that you're laying near the left corner of the bed. Keep your right knee bent the entire time, and just go ahead and slowly drop that left leg down off of your bed. My chair's a little close, so I'm just going to scoot myself back a little bit. There's definitely a bit of a learning curve with the chair placement. So again, don't worry about it. Just be patient with yourself. Just going to get our timer going here. So I'm setting the timer for 5 minutes. Remember, the guideline for myofascial stretching is we want to hold everything a minimum of 3 minutes. But oftentimes we find as we focus on what we're feeling that there's much more good work to be done there than just that minimum of 3 minutes. So listen to what you're feeling. Once you're in this position, make sure that your left hip is still supported on your bed. So if you're feeling any low back discomfort at this point, you may be a little too far off your bed, so scoot back towards the middle just a little bit. We want to make sure that the low back and the hip are on the bed. So if they're not, there might be a small arch in your back and you might already be feeling a little low back pain. So just check in with that. If this is too intense, just scoot back towards the middle a little bit more. There's no rush. You just want to start getting familiar with all of this. You might be starting to feel some sensations in the front of the thigh here, up into the front of the hip, maybe even in your abdomen. There shouldn't be any pain, so we should be feeling some stretching feelings, some pulling sensations, but there shouldn't be sharp pain anywhere in the body. If you're feeling pain in your knee, you might need to lose the chair for now, or just decrease the amount of counter pressure the chair is giving. If you're feeling pain in your low back, again, make sure you're supported on the table. And if it's still low back pain after you're completely supported on the table, give this one a break for now. Bring it up with your myofascial therapist the next time you see them, and you guys can talk about it then. If you're feeling good in this position, that's awesome. Go ahead and outstretch your arms just a little bit. Feel how good that feels too. Anytime we have the opportunity to include the upper body in anything that will open up the front of the upper body, that's always a good thing. So if you did bring your latex ball with you, go ahead and just gently lift up. And let me show you guys. So we're going to be putting it about mid-back here, somewhere between the shoulder blades, and right on the spine is fine if you're using a latex ball. Do not put your firmer balls on your spine, please. Once the ball's underneath the spine and it's just between the shoulder blades there, it should not hurt, okay? So it should feel like you're laying on a ball, but it shouldn't hurt. You can either outstretch your arms like I have mine, or if that's a little uncomfortable for your shoulders, which it may be, go ahead and bring the arms on the table a little more so you're getting some support. We just want to start trying to help the front of the body open up a little more too. And since we're already in this position, it's a great time to do it. If you don't have a ball with you, that's okay. Just holding this stretch, even with no ball or no chair, is great. If you aren't using the ball underneath you, either because you don't want to or you don't have one, see what it feels like to bring your left arm up and let it rest up here towards the head a little bit more, just to increase that stretch a little bit. And let yourself gently experiment. So experiment with what it feels like to reach a little bit. Find where you're feeling a really nice stretch, and then go ahead and stay there. So by now you should be feeling many different body parts getting involved. Take some deep breaths. Soften. Check in with your body. Let it be heavy on the bed. Let your whole body settle into the table. Notice what parts of your body are making contact with your bed or table and which are not. And then you can reach a little bit with your hands too. This is called telescoping. So you're just outstretching the hands and just reaching slightly. So it's not such a big reach that you feel like you're getting ripped in half, or that you're Stretch Armstrong or something like that. It's just enough to elicit a little bit of stretching in the upper body too, and it should feel really good. So just keep breathing. Check in with your abdomen. Is everything as soft as it can be there? You're doing great. If you're at home on your bed and your foot touches the floor, that's why the chair is here, to help you with that. If you don't have a chair near your bed that you can have set up like this, you can just draw the foot back a little bit so that it's actually bending. The top of your toes should be making contact with the floor and just creating a little bit of drag there. But try the chair, it works best. Just keep breathing. So notice what's going on wherever your ball is too. If it's too much at one time, you can just take it out. That's okay. Just come back to that later. So there's our timer. I'm going to take my ball out first. There we go. So this is really important. Before you lift that leg up, this is extremely important. Please tighten the abdominal muscles just a little bit. Just squeeze the abdomen. And then with a bent knee, we're going to lift that leg back up slowly. From this position, it can feel really good to then, whichever leg you were stretching, so it'll be our left leg for now, go ahead and cross that over your right leg. Reach up with your right hand and touch that knee, and allow everything to just fall away from the left side. So this will look different for everyone based on what your knees are willing to tolerate, how your back's feeling that day. It should feel good. If it doesn't feel good, it might be a little too much. So you can see I've got my left hand still reaching, maintaining a nice opening through the upper body. And then you can either let those legs fall over as far as they can comfortably and just hang out there again for about 3 minutes. Or if that's too much for you, just return back to the cross-leg position and just let everything go as far as it can comfortably with support. So there's no rush with any of this. It's all supposed to feel good. So for the opposite side of the body, you'll slowly kind of collect yourself and then either scoot to the other end of your bed, or you'll just reposition so that the right leg's now hanging off. So this is one of my favorite stretches, like I said. It's a great one to do every day if possible. Please always treat both sides, and please make sure that you keep that opposite knee bent the entire time and that you tighten the abdominal muscles just a little before lifting the leg back up. Have a great day. You did a great job. I'll see you soon.